Today we are joined by Dr. Paul Carson, who is an infectious disease physician, and then he's also a professor at the North Dakota State University Master of Public Health program and director of the Center for Immunization Research and Education there. And he's also a professor at the UND School of Medicine and Health Sciences. He's been published in numerous peer-reviewed medical journals and has received a number of awards and honors in his field. And so I'm happy to introduce Dr. Paul Carson today. I forgot to introduce myself. I am Molly Howell, and I'm the immunization director for the North Dakota Department of Health. And I will be moderating today's town hall and also answering some of the questions that we received from all of you ahead of the town hall. So welcome to Dr. Carson.
Good afternoon, Molly. Thanks for having me.
Yeah, so I think we'll jump right in. We had over 70 questions submitted to the North Dakota Department of Health regarding COVID-19 vaccine. So definitely a lot of interest around the vaccine. And so I think we'll just get started with some of the questions that people have. One of the first questions that we received was, when will we know how long immunity to the vaccine will last?
Right. So, that's a question kind of high on a lot of people's minds. Like, how long is this going to last? Are we going to need boosters? And short answer is we don't know. The vaccines have only been in study now for a few months. They've only just been rolled out for less than a month. And so this is going to be something that we will learn as we go. And you can be certain that there's going to be very intense scrutiny about this. We will be following a number of different entities, research groups. The federal government will be following study populations to see what the infection rates are over time. Hopefully, this is a vaccine that gives robust immunity that will last for a lifetime. That's possible. But with what we know from all of our vaccines, it can be quite variable. You can have on one end of the spectrum, like we see with influenza, where we need to get a different vaccine or a new vaccine each year. Or it may be like some of our other vaccines where you need 1 or 2 or 3 boosters over the course of a few months to a few years. I will say this, natural infection, we have a little more experience with, and we are seeing that immunity does seem to be pretty decent, probably lasts for months. Now, again, we've only had less than a year of really being able to observe that, but that's looking good. And what we see of the immune response from the vaccine is even typically better than what we get with natural infection. So I think we can expect the vaccine-induced immunity to even be better than what we would see with natural infection. So I'm cautiously optimistic that the durability of immunity from the vaccine is going to be on the good side.
And you mentioned a little bit about immunity after having COVID disease. And so another question that we get quite often is, should people who previously had COVID or tested positive for COVID, should they be vaccinated against COVID?
Sure. So the short answer to the question, if I've had COVID before, should I get the vaccine? Short answer is yes. Because we don't know how long or how good that immunity will last to the infection. And we do have a handful of examples of people who have clearly gotten a second infection. That's rare. It looks to be fairly rare, but it does happen. I would say this, though, guidance is variable from state to state and place to place. I think it's prudent, given that we don't have really yet enough vaccine to get everybody that we want vaccinated, that if you've had COVID already, it might be a charitable thing to do to kind of step to the back of the line and let other people who have not had COVID and are in one of the current groups that are being vaccinated, to let them go first.
And another question that we've received is, if you are vaccinated, can you still spread COVID if you're infected and maybe are asymptomatic? Can you still spread COVID?
Right. So what the vaccine studies actually studied is, did the vaccines prevent symptomatic infection or severe outcomes? And they did an excellent job at preventing both of those. The studies were not particularly designed to assess whether or not it stopped acquisition of the virus without symptoms or potential spread of the virus. My suspicion is, and I think the likelihood is that it will work for that as well. We have a hint of that. One of the studies on the vaccine did kind of a little glimpse of this by looking at how many people, they tested a subset of people when they showed up for their second dose of the vaccine. They did, PCR testing for the virus. And there was about a 66% reduction of finding virus. Now, the people who showed up with virus were very low in both groups, the placebo and the vaccine group. But the placebo group had about, I should say the vaccine group had 66% less virus present than the placebo group. So we've got a first hint there that it actually may prevent acquisition or transmission of virus. There are formal studies that are being conducted to look specifically for that question.
So it looks like it may prevent asymptomatic infection by about 2/3 in a small proportion of people that participated in the clinical trial. And even so, I think the main point is that both vaccines are preventing symptoms of COVID and severe illness from COVID is what the most important thing and what we're trying to prevent in the COVID pandemic.
Absolutely.
So another question that we have received recently, especially with a lot of the media attention around the new strain of COVID that's circulating, is will the current COVID vaccine protect against the new strain that's been circulating of COVID-19?
Right. So SARS-CoV-2, the cause of COVID-19, is an RNA virus, and they tend to be a little bit sloppy in how they replicate. So that means they can accumulate mutations over time. Thankfully, it is not anywhere close to being as what we would say sloppy or promiscuous, if you will, as like influenza is, which changes a lot from season to season. It's much slower than that. That said, we do have now at least a couple of different newly circulating strains, one that first kind of came out of the UK, one that's been identified out of South Africa. These have accumulated a handful of mutations that make them a bit different than the original circulating strain. Thankfully, there's actually already been some studies looking at how well the antibodies produced to the current vaccines that we have in use. And it shows that the antibodies made to the vaccine neutralize both of those new strains. So I think we're all pretty optimistic that these vaccines will be protective against even the new strains that are circulating.
And so a lot of the questions that we've been receiving here at the health department, and I can probably answer some of these, I think the number one question that we've received is, how will I know when I'm eligible to receive the vaccine? We have a list of priority groups and phases on our website, and how will I know when it's my turn and where do I go? And so I just wanted to let the public know that North Dakota has a COVID-19 vaccination ethics committee that has been meeting for the past couple of months and really looked at science and ethical principles and tried to prioritize who should receive the vaccine first, knowing that it was going to be in limited supplies. And so we have phases on our website for the order of priority for who should be vaccinated. And phase 1A really was focused on healthcare workers, first responders, and long-term care residents. And we have informed healthcare providers that if they have enough vaccine and they feel like they've offered it to everyone in that phase 1A, that now they can start on phase 1B, which really does start with people 75 and older, and then goes on to people with 65 and older with underlying health conditions, other congregate settings. It eventually gets to everyone 65 and older, and then also includes teachers and child care workers, or I should say employees of school K through 12 schools and child care workers. And then phase 1C is more of essential workers, and then also younger individuals with one underlying health condition. And so I encourage everyone to go to the North Dakota Department of Health website, which is www.health.nd.gov, and take a look at those different phases and priority groups. It is difficult to say when you'll be eligible, as North Dakota's receiving less than 10,000 doses of COVID vaccine a week. And so it really is dependent on how many people in an earlier priority group are choosing to be vaccinated as to how long it will take to get to your priority group. Yesterday, the Department of Health did stand up a COVID vaccine locator. And so that's also on our website. And so you can go on our website, you can put in the county you're located in or the city you're located in, and look and see which providers in your area have COVID vaccine and which priority group they're currently vaccinating. And that should kind of help you find out where COVID vaccine is available. And if COVID vaccine is not available in your area, which is definitely possible because doses are so limited in the state of North Dakota, I just want to reassure everybody that when we get to your priority group, we will eventually get to you. But for example, for the 75 and older population, it may take weeks before we're able to vaccinate everyone in that population. And so please be patient, but I promise we won't forget about you. We will get to everybody eventually who's interested in vaccination. But we have seen a lot of interest in the vaccine, and I just wanted to remind people to be patient, but pay attention to our vaccine locator and local media. We'll keep everyone up to date as to where we are on the priority list for vaccination. And so also on the vaccine, I think when people are thinking about being vaccinated, there's a number of people who do have underlying health conditions, especially in that 75 and older, the 65 and older age group. Is the vaccine safe for people with underlying health conditions, Dr. Carson? And should people with those conditions be vaccinated?
Yes, absolutely. I mean, those are the people that we actually like to be kind of towards the front of the line here. So there's really no contraindication to the vaccine unless you have a specific allergy to one of the known components, which frankly should be pretty uncommon or rare because these components are not in widespread use in prior vaccines. But the conditions that put people at risk for a worse outcome are specifically the people that we want to be vaccinated. And there's no indication that this vaccine should be at any higher risk for those people. We sometimes think about that with live virus vaccines. We sometimes have to be a little bit careful with people with weakened immune systems when we give a vaccine that contains a live virus. This is not one of those. This is not a live virus vaccine. So this really should be safe for all comers, except if you have a known severe allergy to one of the vaccine components.
All right, I think another question that we've been getting, and for some reason it seems to be coming more from the 65 and older population, is it true that the Pfizer vaccine is more effective than the Moderna vaccine in the 65 and older population? So should people 65 and older be saying, no, I want to wait for Pfizer vaccine?
Yeah, so my short answer to this would be, and this is what I told my parents and my older aunt and uncle, is get whatever vaccine you can get into your arm first. These vaccines, both of them, have just outstanding efficacy. They are in the pantheon of some of our best vaccines we've ever had at our disposal. Now, to answer the question more pointedly, the Pfizer vaccine looked at age groups, breaking them down by 16 to 55, over 55, greater than 65, greater than 75, basically found the same efficacy in all of those age groups. But as you break those down, the numbers of people and the numbers of events got smaller and smaller. And so there's a much wider, what we call, confidence interval of where the actual number is. So when you look at that same thing with the Moderna vaccine, so on the Pfizer vaccine, it was about 95% in all groups. With the Moderna vaccine, it dropped down. They broke it down. The oldest group was just, they lumped together over the age of 65. There it was about an 86% efficacy. But when you look at what we call the confidence interval, that means the range of where the true percentage really lies. It was essentially the same for both trials. I would take whatever vaccine you can get in your arm first.
So if you're offered Pfizer or Moderna vaccine, definitely take whichever one you can get. I know another question we get is about first and second doses. So both of these vaccines are 2-dose series, meaning that you need 2 doses to achieve that ultimate or optimum efficacy or protection that you want against COVID disease. The Pfizer vaccine is 3 weeks apart between the doses, and the Moderna vaccine is 4 weeks apart. We did have a question if second doses are going to be reserved for people who receive a first dose, and I can kind of take that one. Right now, how it's been working is we are receiving less than 10,000 first doses of COVID-19 vaccine each week into the state. And so far, I can say when the interval comes up for when people should receive second doses, we have been receiving allocations of those second doses. And so people have been able to receive their second doses if it was Pfizer 3 weeks later, and if it was Moderna a month later after they received their first dose. And so I just want people to realize that you will need 2 doses. The person who is vaccinating you will let you know when you are due for those second doses. Oftentimes, healthcare providers, they've been even scheduling the second doses at the time that people receive first doses. Also, everyone will receive an immunization record card, and on that card, it will also tell you when you're due for subsequent doses. So I don't want people to be worried about the second doses. So far, they have been there when people need the second doses. Another question that we received is about a lot of safety questions. So I think maybe we'll start on the safety questions. If someone had a physical reaction or side effects from the flu vaccine, how likely would they be to have side effects from COVID vaccine? Do you want to take that one, Dr. Carson?
Sure. So all these vaccines are very different and have very different components in them. So there's really no good reason to expect that if you had a reaction to some other particular vaccine, like the flu vaccine, which is made very, very differently, has very different components in it than the COVID vaccine, that you should have problems with this vaccine. Really, the only thing that people need to be, I think, attentive to right now is the allergic reactions that are being reported in higher than what we see with vaccines overall, but still a very, very low rate. Normally, severe allergic reactions occur with most other vaccines in about 1 out of 1 million people. This is more in the neighborhood of 1 out of 100,000. And all of those severe allergic reactions have been able to be managed pretty readily with regular medical management, which is usually a quick shot of epinephrine and monitoring. And people have done fine after that. So the concern would be is if you have a known allergy to one of the components. The two main components that are being talked about of concern are polyethylene glycol, sometimes called PEG, and polysorbate. Actually, polysorbate's not actually in the vaccine, but it's similar enough to polyethylene glycol that most experts say if you have a known allergy to either of those compounds, you should avoid the vaccine. Otherwise, it's really kind of good for all comers. That is the main and only significant concern at this time.
Yeah, you touched on the severe allergic reactions. I think it's a good reminder for the public that when your healthcare provider asks you to sit 15 minutes after vaccination, or some people, if you have a history of allergic reactions, your healthcare provider may ask you to sit or wait for 30 minutes after vaccination. That's why we want you to do that. We want to make sure, in case you do have an allergic reaction, that there's a healthcare provider right there that can assist you and provide management or treatment for that allergic reaction. So I think that's a good reminder as to why we ask people to wait after they're vaccinated. Another question that we're getting is a lot on the priority groups phases. I think one question is, will priority groups or who people are vaccinating differ by what city or county that you're located in? And I can take that one. It will be different based on location, and that's because it's really not possible to ensure, that the entire state is on phase 1A or vaccinating healthcare workers, and then that the next day everyone's vaccinating phase 1B. That would probably mean in certain areas of the state we were asking healthcare providers to wait to continue vaccinating until others caught up, and we don't want vaccines sitting in refrigerators or freezers at all. We want it going out to the public. And so you may see that in one city in North Dakota, a lot of the providers are vaccinating, the 75 and older population, but in another city, they might still be working on healthcare workers and long-term care residents. And eventually that will all kind of even out. And as we do our allocations from the state, we are watching that, and we'll try and even that out as much as possible. But acceptance of vaccine will vary by location, and as well how good our population estimates are for the different priority groups. So it is possible you'll see different areas vaccinating different priority groups. And that's why we want people to pay attention to local information about vaccine availability and check our vaccine locator to see who's being vaccinated in your area. Another question that we've been getting is about snowbirds. I know many North Dakotans are lucky enough to go down south for the winter, while the rest of us are up in North Dakota. But we've gotten a lot of questions about, am I able to get my first dose in North Dakota and my second dose down south, or vice versa? And I want to just let the public know that you should get vaccinated when your priority group comes up. And so if you're still in North Dakota, get vaccinated in North Dakota. If you're down south and vaccines available and they're on your priority group, definitely get vaccinated. And if you're not able to get your second dose in different states, you'll get an immunization record card, which will show which brand of vaccine that you received in the other state. And so just keep that record card with you, and we'll get you a dose in whichever state you're in for your second dose. So if you got vaccinated down in Arizona for your first dose, you can get your second dose when you come back to North Dakota. But it is important that we know which brand of vaccine that you received, because people really should get the same brand for both doses of COVID vaccine. Another question that we received ahead of this town hall is, will the COVID vaccine have any long-term effects? I'm assuming they're meaning side effects.
Right. So let me just first couch this in in kind of terms of how we study all vaccines. And we know from pretty much, vaccinology in general that almost every serious adverse event that we see that might follow vaccination occurs within the first 6 weeks after vaccination. There's a very rare condition that can happen that's called antibody-dependent enhancement that can occur later, but that's a very uncommon thing. And when that's identified, a vaccine is usually removed from the market, or the indications are changed. And this vaccine has not shown any signs of that. First, it's a very unusual thing for that to happen. This vaccine has all the typical safeguards that we have for monitoring acute and late or later term complications. We have what's called the Vaccine Adverse Event Reporting System, which is out scouring for these types of events. There's a new additional monitoring system where it's a text-based thing when people sign up to, where you get a text reminder to say, how are you doing? And it's following recipients out for several weeks. This is just something that does not happen almost at all with other vaccines. We have no reason to expect that with this one either. But you should couch this in the terms of weighing that rare, questionable, theoretical problem with what we know about the virus right now. And what we know about the virus is it's causing a lot of long-term effects in people. This whole condition of what sometimes is colloquially called long COVID or long haulers is becoming to be a very real phenomenon. And I have some colleagues that are developing clinics for just the people who have had chronic lung damage that have occurred from COVID. We now have almost over 750,000 people in the United States that have been hospitalized with COVID, and half of them are experiencing fatigue months after their infection, what they call brain fog, what they call, and then evidence of scarring in their lungs, sometimes evidence of heart damage. That's what we really need to be worried about, is what are the long-term effects of the virus, which are very real, and this vaccine protects against that. I would really try and reassure people that I think that likelihood of long-term problems with the vaccine is very unlikely.
So really, people need to weigh the risks from COVID disease or severe COVID disease or spreading COVID to a loved one who might be vulnerable with the benefits and the risks of the vaccine, which for the vaccine, the side effects really look like fairly mild to moderate fever, headache, muscle pain, joint pain, and then the rare severe allergic reactions, which I believe CDC is reporting at 11.1 cases of a severe allergic reaction after COVID vaccine per 1 million doses administered. So much more rare than what we're seeing for COVID deaths and hospitalizations. Another question that we've been receiving is if after you're vaccinated, if you still have to wear a face mask, do you still have to quarantine? We're also getting questions if after people are vaccinated, if we can lift, the visitation at our long-term care facilities. I think both of us probably can address this. I'd be interested in your thoughts. I know you're also kind of you're the medical director of a long-term care facility or a couple long-term care facilities. What are your thoughts on what impact COVID vaccine is going to have on long-term cares and hopefully someday being able to open up visitation at long-term cares?
Right. So I'm acutely interested in this. I think the lack of visitation and the isolation that our elderly residents of long-term care have had to endure through this pandemic has been tragic and very difficult. And we need to get past that as soon as possible. And the vaccine is our only path to that, honestly. Now, there's kind of sticky things to try and navigate with that because the Center for Medicare and Medicaid Services is the entity that regulates nursing homes. They'll say, when we can stop doing those things or not. But my hope would be, and my desire, and if I'm lobbying for this, would be when we have a fully vaccinated workforce and we have a fully vaccinated residents, and then a fully vaccinated visitor who wants to see them, yes, we open the doors. That would be what I desire, what I think would be reasonable, and the right approach. And maybe it's not everyone, but at least, getting to where we have in the facility what we think is the, close to the number for herd immunity, where you would have an unlikely spread throughout that facility, which would probably mean something in the neighborhood of 70+% of the workers and residents vaccinated, and visitors being vaccinated.
And then just to touch on, whether we still need to wear face masks after we receive a vaccine, or we still have to quarantine if we're exposed, because the vaccine it's not 100% effective. They were 94 to 95% effective in clinical trials. And then also the vaccine is coming out slowly, so we don't have a large percent of North Dakotans that have yet been able to receive the vaccine. And you really do need 2 doses and about a week to 2 weeks after both doses to ensure that level of immunity. We are still recommending North Dakotans wear a face mask, practice social distancing, and then also at this time, we are still recommending quarantine if exposed to COVID-19. But I do think in the future, these are all things we're going to be looked at, and we have hope that we'll be able to change some of these and get back to more normal as more people are vaccinated and we have more information on the vaccine. And so I think more to come on that area. We got another question about vaccination clinics, and is North Dakota planning any large mass vaccination clinics at larger venues like other states? I do think, and let me first say, it's really up to the local health departments and local communities to plan how they want to vaccinate individuals in North Dakota. But I will say, I know a lot of local areas are planning on doing large mass vaccination clinics. And so I think pay attention to local information, and you may see more clinics at large venues like, the Civic Center here in Bismarck or the Allergic Center in Grand Forks. And I think the reason for that is it really, one, you can vaccinate a large number of people much quicker than having them come to a clinic. And then also, we are still in the middle of a pandemic, and we don't want people spreading COVID at our vaccination clinics and congregating in small places together. And so I do think you're going to see some mass vaccination clinics across the state, especially if we see more doses or increases in how many doses we're receiving each week. And I do want to reassure the public that healthcare providers do have plans to ensure social distancing. All of our vaccinators were in phase 1A. And so the people that are giving you the vaccine have already been vaccinated. And so you can be reassured that if you do attend a mass vaccination clinic, that COVID won't be spread at that vaccination clinic. But if you do attend one, please wear a mask in case you do have COVID and you don't realize it, as we don't want to spread COVID at the clinic. Another question that we received is, are we seeing more side effects in people who previously had COVID after they're vaccinated? Do you want to take that one, Dr. Carson?
Yeah, let's just talk about side effects just a bit more. Molly, you alluded to it to some extent. So first of all, side effects of what we call local side effects, kind of a sore arm, a little bit of inflammation in the arm, very common, like 65 to 80%. Interestingly, that tends to be less as we get older. So the side effects tend to go down as you advance in age. The systemic side effects, like low-grade fever, that can happen more in the range of like 10 to 15%. Fatigue, kind of common, up to maybe about a half. Again, less often if you're older. Headaches, chills, muscle pains. Those side effects are common. We are anecdotally hearing and seeing that maybe they are more common in people who have had COVID in the past. I haven't seen actual data on that, something we're all kind of interested in. It stands to reason, that if you've had COVID in the past and you've made some immunity to that, then when you get stimulated with something that's going to goose your immune system again, that you might get more side effects. I look at all of that as a good thing. I just had my second dose of the vaccine. I kind of had a lot of those symptoms the second day. I had achiness, a little headache, mild chills, fatigue, and I was just cheering my immune system saying, go, go, go. I was happy to kind of know that it's doing its job, and it all went away by the next day in myself. But I do think anecdotally we are kind of hearing that, and it has some biologic plausibility.
And while we're kind of on the side effects, what are your thoughts on if people should take Tylenol or ibuprofen after they're vaccinated, if they have a fever or even for any sort of pain, whether it be muscle pain or headache, and will that affect how protective the vaccine will be or the vaccine's efficacy?
Yeah, so I'll tell you, what the kind of standard recommendation is, what my kind of slight opinion is, and then reality. So when for example I went to get my vaccine, the nurse who administered it had a sort of standard sheet saying take Tylenol or take ibuprofen should you have any of these side effects. There is some data out there that with first time new vaccine, when you take anti-inflammatories, that it might blunt your immune system a bit, that it might blunt the response you get to the vaccine. The data on that for a booster dose, which these vaccines have, is that it doesn't do it then, that when you get a booster dose, you get just as good an immune response whether you give those anti-inflammatories or analgesics or not. I myself, when I got the vaccine, I was sort of determined to tough it out, and I wasn't going to take anything, and I wanted the full immune response, whatever I could get. And by the end of the day, I took 2 ibuprofen, and all of the side effects went away. So I didn't make it a full day, and I felt fine the next day, and I think that's fine, and I'm pretty confident I still got a good immune response. So, I think if it's mild and you can tough it out, maybe do that, but I wouldn't feel bad if you just say, I want to take some Tylenol or I want to take some ibuprofen.
Okay.
I see one other question that popped in. How do I know if it's a shot side effect or a COVID symptom? It's a good question. COVID is most of the time going to be accompanied by some respiratory component. So sore throat, cough, a very specific finding, although it's not in everybody, is the loss of the sense of taste or smell. There's actually been some studies now saying we should be screening with that, like, pull out your jar of Vicks VapoRub or, cut an orange in half. And if you can't smell it, then maybe go get tested. But if it's just the achiness and the fatigue and so on, right as you'd expect 24 hours after or less after the vaccine, I think you can attribute that to the vaccine. And it shouldn't really persist beyond a couple of days. If it's persisting or getting worse, then I think you might want to go get tested.
All right. Another question that we received ahead of the town hall today was from somebody who moved to North Dakota from out of state, and we've also gotten questions from people along the border if North Dakota will vaccinate out of state residents, and the answer is yes. If people move to North Dakota, of course, yes, we would like you to be vaccinated and have access to vaccine. And then also, if you're an established patient of a healthcare provider in North Dakota, but you're on the border, whether that be, East Grand Forks or Moorhead or even along the South Dakota-Montana border, that our North Dakota healthcare providers can vaccinate you, especially if you're an established patient. I will say, though, North Dakota will not receive additional allocations of vaccine for out-of-state residents. So So we do want to kind of watch, how many out-of-state patients, and ideally we don't want people, driving to North Dakota from, states away to try and get their vaccine. But yes, if you normally get your healthcare in North Dakota, you should be able to have access to COVID-19 vaccine. Another question that we got was about the extra doses in the vials. I know for the Pfizer vaccine, which is a 5-dose vial, healthcare providers have been able to get, 6 or 7, even 7 doses sometimes out of that vial. And then for the Moderna vaccine, sometimes they're getting 11 or 12 doses. And there was just a question what we're doing with those extra doses. Providers are giving those extra doses, and they're giving them to people according to the priority groups they're vaccinating. A lot of providers have waiting lists, and so if they have extra doses at the end of the day, they're offering them to people who are on the waiting list. And so we definitely are using those extra doses, and so I wanted to assure the public of that. Dr. Carson, I just wanted to get your thoughts. Another question that we've received quite a bit is on COVID vaccine and fertility. I know there was some social media and some misinformation out there about COVID-19 having a negative impact on fertility. Did you want to address that?
Sure, I'll try and be succinct. It's kind of a esoteric immunology kind of question. So let's just talk about the origins of this. The origins of this were a UK physician and a German physician, both who were very politically involved in their respective countries, who were kind of back in October denying the pandemic, saying it was way overblown, saying we didn't need to do any sort of measures to protect against this. Kind of got a little bit criticized in their own countries for putting out those ideas. One of them had been a previous researcher at Pfizer, not a vaccine researcher, not the director of research as posted on some websites erroneously. And they kind of doubled down on this in December by putting out a conjecture that a little protein that's in the placenta called syncytin-1 had a little segment of it that was similar enough to the spike protein that maybe if you made antibodies to spike protein, maybe those antibodies would cross-react with this placenta protein, and maybe that could lead to infertility. No data on this, no animal studies on this, nothing clinical that suggested this, just a theory. Top immunologists kind of looked at this posting of theirs and said, this is almost impossible. The similar segment of the proteins in the placental protein, the syncytin-1, is so buried in the protein that the antibodies made to the spike protein wouldn't normally find that. But we've already got pretty good idea that this is a non-starter, because there have now been over 90 million SARS-CoV-2 infections in the world. Presumably half of those are in women. All of those infections have spike protein. All of those infections lead to antibodies to spike protein. All of those 45 million infections in women, if antibodies to spike protein were to lead to infertility, ought to have been leading to infertility over the last year. We have not heard any reports of that. We've not seen any evidence of sort of a rash of infertility cropping up anywhere. More importantly, it would, if that were true, it would cause damage to the placenta of pregnant women, and the expected outcome of that would be an increase in miscarriages. That is not something, and we've got now, even just in the US, over 150,000 reported pregnancies with COVID, and no increase in miscarriages or spontaneous abortions. What pregnant women do need to fear is that if you're pregnant and get COVID, you have a 3 times greater chance of landing in an ICU than your non-pregnant counterpart. You've got almost a 3-fold increased risk of landing on a ventilator, and you've got about a 70% increased chance of dying from COVID than your non-pregnant counterpart. We specifically would like to see women contemplating pregnancy, or I would say even pregnant, getting the vaccine, because the deleterious effects of the virus are significant, and this infertility thing is just not real.
So basically, for the claim that COVID vaccine causes infertility, if the claim that's been, passed around social media was true, then we would expect the disease to also cause infertility, which we haven't seen yet. It looks like in the chat we're getting a lot of questions around what underlying health conditions put you at high risk for COVID-19, or when we say people with one or more underlying health conditions or two or more underlying health conditions, who is that? What conditions put you at high risk for COVID-19, and meaning that you should be vaccinated against COVID-19?
So I'm going to answer the first part of that, and I'm going to reflect it back to you on how we determine that in the state. Like, is it self-determined, or does somebody review the record, or how does that play out? So the CDC lists several diseases that are known risk factors for a more severe outcome from COVID. If you want to see the full list, I'd encourage you just Google CDC high-risk conditions COVID. You'll find the list. But it's cancer, chronic kidney disease, COPD or chronic obstructive pulmonary disease, Down syndrome, heart disease like heart failure or coronary artery disease, being immunocompromised, obesity with a body mass index of above 30, and even more so with severe obesity, body mass index above 40, pregnancy, as I just mentioned, sickle cell disease, smoking, and type 2 diabetes mellitus. Those are the known definite conditions that put people at risk for a worse outcome. There are others that are being debated, and they may put you at increased risk: asthma, prior strokes, cystic fibrosis, high blood pressure, neurologic conditions, liver disease, being overweight but not obese, pulmonary fibrosis, and type 1 diabetes. So I'll put it back to you, Molly. Like, how is that sort of assessed when people say, "Am I in a risk category and can I get the vaccine?"
Yeah, so if people take a look at our phases of vaccination in the priority groups, we often reference, like, I think for phase 1B, the first group is everyone 75 and older, but then the next group is people 65 or older with two or more underlying health conditions. A lot of our healthcare providers are using their electronic medical records to notify patients who meet the criteria for being at high risk for COVID and need to be vaccinated. And so many people, if you have an established provider, which hopefully people who have any of these underlying health conditions are regularly seeing a healthcare provider for management. And so you'll likely be notified by your healthcare provider when you're eligible for vaccination. Also, vaccine will, be available at pharmacies as well. And so they know which medications individuals are on and which underlying health conditions put people at high risk for COVID. And so they'll have some sense of who has underlying health conditions. But I will say, if you're going to a large mass vaccination clinic, you don't need to bring a copy of your entire medical record with you to a mass vaccination clinic. We really are going on people being honest, or trusting that people are going to be honest if they have underlying health conditions, and that they need to be vaccinated. We're not going to require some sort of proof. And then I also want to mention, there is a list on CDC's website, and Dr. Carson just mentioned a number of the conditions that put you at increased risk for COVID, and those you should be vaccinated. But those are conditions that CDC has, evidence of. There are conditions that are pretty common, and so there is data, even with COVID being new, that people are, have severe illness. There might be some rare conditions that are not on that list, and so a lot of this will ultimately be up to the healthcare provider to determine which patients should be vaccinated and who's at high risk for COVID-19. And so even if you don't necessarily have a condition on that list, I encourage you, when that group is up, to talk to your healthcare provider and see if you're a candidate for COVID vaccine. And since we have Dr. Carson today, and I know you're a member of the Catholic Medical Association, I feel like I have to ask you, because we get this question also, about should Catholics be vaccinated against COVID-19? I know there's been some questions about the use of fetal cells in the vaccine and if it's ethical to be vaccinated against COVID-19.
Yeah, so let me just first address the overall question about, are there aborted fetal cells in the vaccine, or are they made with aborted fetal cells, or what is the connection to that? So that people can have a general understanding of that, and then I can speak specifically to the Catholic Church question. So the way these current vaccines are manufactured are that they don't use cells at all to make them. It's a synthesized piece of genetic material that has nothing to do with cell cultures or cells in any way, shape, or form. There's no possibility for there to be remnants of fetal cells in there, nor are they used in their production. Now, there is a tangential relationship to fetal cells in the early studies of both of these vaccines, where they were trying to, show that this RNA could get into a cell. They used fetal cells to see if it could get in because they're a human cell, and they wanted to see if it could get into a human cell. And one of the other vaccines used virus grown in a cell line to characterize the spike protein. That was sort of to lay out the original science and proof of concept that laid some of the groundwork for these vaccines, but they're not used at all in now the companies that manufacture them. The Catholic Church in particular has weighed in on this through various entities, which include the Pontifical Academy for Life, the Congregation for the Doctrine of Faith. Pope Francis has spoken about it. All of them say that that connection is so remote that any Catholic can in good conscience receive these vaccines, and even are encouraged to receive them because of the serious threat and the nature of the current pandemic and the danger that it poses to all of us, and if we carry it even asymptomatically, the danger we pose to others. So it is fully considered licit and even endorsed by the Catholic Church. Now, I will say that the upcoming vaccine, because there was an earlier question about when is a third vaccine I saw in the chat box going to be due. The next one sort of in the dock is the Johnson & Johnson vaccine. This is a live virus vaccine. It uses a modified adenovirus that doesn't make humans sick, and it carries the gene for the spike protein. That one I think is coming up for review with the FDA in, do you know, Molly, like a week or two, I think. I don't know I know it's soon.
Yeah, I think I've heard that Johnson & Johnson may be ready to submit to the FDA for review at the end of this month, and so then it would take a couple of weeks. So I think best estimate would probably be mid-February for when if the vaccine will be authorized, that it would be available.
Right. So that vaccine, just for people's information, I think has a good chance of being approved. There's a model for that vaccine from before with Ebola, an Ebola vaccine. And that has a lot less storage issues, and it has the possibility of being just a one-dose vaccine. However, back to the original question here about ethical concerns, that one is grown in a cell culture line that was originally derived from a fetus. And I'd have to go back and look at that particular cell line, because one of the cell lines, it's not clear if it was an aborted fetus or a miscarriage. And I'd have to check on that one, but it may be that it was one of the aborted fetal cell lines from decades ago. And so that one is grown in it. The connection is a little closer than with the RNA vaccines, although here again, the Catholic Church would say that this is still far enough removed from the individual's choice there that a Catholic in particular could receive these in good conscience. But you have these other choices that are further remote.
And I believe I saw this week that the Pope got his vaccine. So so I think we can be rest assured that it's okay to get vaccinated if you are Catholic. We only have a few minutes left. I know we have a lot of questions about priority groups and timing. And so I just want to reiterate to those of you who are watching today that North Dakota, we are working to get all the vaccine administered the same week that we're receiving it from the federal government. We're doing a pretty good job at that. And we are receiving less than 10,000 doses a week of COVID vaccine for first doses. And so I just want to encourage the public. I know there's a lot of interest in this vaccine, which we're happy to see. Please be patient. When we get to your priority group, we're not going to leave anyone out. Eventually, everyone in that priority group will be offered vaccine. We have a vaccine locator on our website, and we hope that will assist you in finding a provider in your area who has vaccine available, and we'll give you some instructions as to what to do if you're interested in being vaccinated. For those of you who don't have access to the internet or aren't comfortable using a computer, you can also call our hotline, and they'll walk through the vaccine locator with you. They can't get you vaccine or make you an appointment, but they will tell you where vaccine may be located or if there's vaccine in your area. So I want to mention our hotline number. That's 866-207-2880. And so if you have additional questions about COVID vaccine, you can call there. Also, they can definitely try and help you find vaccine or let you know if it's in your area. And with just 1 minute left, I just wanted to thank Dr. Carson. Thank you for helping us answer North Dakotans' COVID-19 vaccine questions today. And I also wanted to thank everyone for participating. And please just look out for local information regarding COVID-19 vaccine. Thank you.